Thanks for joining us to review our program evaluation about Take Control Philly. Take Control is funded by the City of Philadelphia Department of Public Health and has been established since 2011. Its target audience is teenagers between 13 and 19, and the purpose of the program is to improve sexual health knowledge and increase condom accessibility, as well as normalizing and increasing condom use and reducing rates of sexually transmitted infections. You can see that this is important as only 49% of teens report condom use, and Philadelphia teens are 3 to 5 times more likely to contract an STI. The program provides all types of condoms and lubricant, either through the mail, at partner sites across the city, or at 7 partner schools. They also provide drop-in STI screening at 2 centers in the city. While there isn't information available about the number of teens served by the program, over 480,000 condoms were distributed in 2022.
So for our setting and population, the program that we're evaluating takes place or is being carried out in Philadelphia, Pennsylvania. According to the U.S. Census Bureau, in 2021, the city's population is 44.4% white and 43.6% Black or African American. The poverty rate in Philadelphia is 22.8%, and it is the 3rd highest STI rate in the U.S., with decreased condom usage, insufficient school sexual education programs, and a lessening concern about STIs all contributing to this disparity.
The central question of our evaluation is, are sexually active teens who participate in the Take Control program more likely to use condoms than those who do not participate? Although this question does not seek to make claims of causality, understanding the associations between program participation and condom use will provide valuable information for assessing the program's primary outcome of interest. In addition to our primary question, two secondary questions we'll seek to answer are: what is the preferred condom distribution method, either in-person pickup or mail delivery, amongst teens who participate in the program, along with what is the preferred condom type amongst teens who participate in the program? Both of these sub-questions support continuous program improvement by informing our understanding of participant preferences so that we can accommodate those preferences better in the future.
Prior research shows that several condom availability programs, or CAPs, have been evaluated, but most of these have been school-based, not community-based, the way that Take Control Philly is. A study conducted in 2018 found that school-based CAPs increased the odds of students obtaining condoms, and a literature review in 2019 found high acceptability of CAPs and that CAPs had the ability to increase condom usage among high school students. However, research is still limited in regards to preferred condom distribution methods, preferred condom types, and the impact of CAPs on adolescent STI rates, all of which our evaluation seeks to address.
The Take Control program will increase condom usage amongst participating Philadelphia teens between the age of 13 and 19 years old. Our inputs include staff, volunteers, youth leaders, educators, and outputs include giving out condoms and lubricant, offering sexual education, performing STI and HIV screenings, and it requires a participation of Philadelphia teens age 13 through 19, high school staff, clinical staff, and the Department of Health and local governments. For our outcomes, our short-term outcomes include program awareness, increased condom usage, improved community attitudes surrounding discussions about teen sex, and our long-term outcome is reduced incidence and prevalence of STIs among Philadelphia teens. It's based on the assumptions that teens are aware that the use of condoms and other barrier methods can reduce the risk of STIs. And some external factors are competing policies that affect program funding.
The primary indicator of the Take Control's program success is increased condom usage during sexual activity among teens who utilize condoms distribution from Take Control. In 2019, as we stated before, only 49% of Philadelphia teens reported condom use during sexual activity, and we'd like to evaluate whether condom usage is at least 65% among teens who utilize Take Control's free condoms compared to the comparator group, which we do estimate to be about 49%. Secondary indicators are the percent of teens who utilize the in-person condom pickup system versus the online delivery method. And finally, the tertiary indicator is the percentage of teens who use male condoms and the percentage of teens who use female condoms.
Our evaluation will utilize a quasi-experimental design to evaluate whether teens who have received condoms through Take Control are more likely to use them than a comparator group. Because of the ethical concerns associated with the random assignment of sexually active teens to a control group that would not receive free condoms, a quasi-experimental design with a comparator group was felt to be more appropriate than an experimental design. Our comparator group should be demographically similar to the Take Control group in terms of sexual activity, age, sex assigned at birth, gender identity, sexual orientation, education, socioeconomic status, and race. It'll be especially important for the comparator group to have characteristics similar to those for Take Control on factors that could have a direct impact on outcomes. For example, ensuring similarities in socioeconomic status is paramount as poverty is associated with inconsistent condom use. We will utilize quantitative methods in the form of an online survey to address our questions regarding condom use and distribution method preferences. This method was chosen as the primary focus of the evaluation is hypothesis testing and quantifying the impact of a condom distribution program to determine if there is a difference in condom use between the two groups. Questions regarding distribution methods are limited to 3 options, so the same survey will be used, and that will help control our evaluation costs. Quantitative methods allow for standardization and make it easier to determine the reliability and validity of the measured variables. Finally, for participants 18 and older, we will utilize active consent, in which an informed consent form will be included prior to the survey. That will explain the study purpose, any benefits or risks, information on their confidentiality protection measures, their rights, and a contact for those who may have questions about the study. For participants under 18, an email will be sent to their parents or guardians with a form that they will complete to indicate their consent for their child to participate, and surveys will only be sent to children whose parents have provided active consent. In addition, we'll include an informed consent page at the beginning of every online survey that asks the adolescent to also provide their assent to participate.
We plan on using a survey that we developed that's specific to teens in Philadelphia. The survey will be distributed online for ease of data capture and analysis, and we plan on piloting the survey to ensure its validity. We'll survey schools that partner with the Take Control program and schools that do not, so that we have 2 comparator groups. And we'll make sure these schools do have similar demographic data like race, gender, and socioeconomic distribution, but we'll still ask survey participants about their individual demographics so that we can stratify results. We will administer the survey twice among both groups during our year-long evaluation period in order to capture as many responses as possible. Students who took the survey once will not be eligible to participate a second time. And here's just a sample of the survey that we plan on using. We ask whether teams are aware of Take Control, where they received their condoms from, whether they used a condom in the last 3 months, what type of condoms they used during that encounter, in addition to demographic questions that are not shown here. We ask about sexual encounters within the last 3 months to anchor the survey within a set time frame. So this will be a cluster sample as we are selecting students from school environments. We calculated that we'll need 163 students in both groups for a total of 326 students. 163 students is the minimum in each group, and we will attempt to capture as many responses as possible, which is why we plan on disseminating the survey twice. We calculated the sample using a one-sided test with a confidence interval of 95% and a power of 90%. Since we do not suspect that the Take Control program lowers condom usage among teens, we feel that a one-sided test is appropriate.
Our timeline for the evaluation spans 12 months and includes all major milestones. The first 3 months will be focused on preparing our plan, developing and finalizing our survey tool, and completing requirements associated with IRB approval and receiving parental consent. Months 4 through 7 will then cover the first round of surveying, analysis, and development and presentation of a mid-evaluation report. And then lastly, the final months will be focused on the second and final round of data collection, analysis, and creation and presentation of the final evaluation report. And that concludes our presentation. Thank you so much for your time.